Yeah, so thank you for the introduction. So I'm the suicide prevention lead for the ICS. So I'll share with you. I'll be as quick as I can because I'm aware we're over in time. It'll just be me giving the presentation, and then at the end, if there's any questions specifically to anything that I talk about, I can hand over to my colleagues if there's something that I can't answer. Thank you. Next slide, please. So one area that we're currently in development with in relation to self-harm is within our real-time surveillance systems and our data collection. So across our region, we currently have 2 ambulance services, NWAS and NIAS. NWAS is a bit more advanced and they are collating data on self-harm, whereas before we would just be getting the data on attempted suicide. But now we're really in progress with this, which is really, really valuable to the work that we're doing. We've currently created some developed relationships with NIAS, which is the other ambulance service more in the northeast of our region. And although the system isn't yet in place, we've got some good progress. So we're hoping that will take off very soon. The benefits of this, like I've just said, it's really valuable so that we can identify key themes, any areas for development, any particular groups of patient service users that we might need to focus a bit more work on. And the drawback, really, the main one at the moment, is that it's not consistent across the region. So we can focus on certain parts, but not on others so much with this data. Thank you. Next slide. We currently have some research projects underway that are in collaboration with our network. I won't go into great detail on these, but again, we can take questions. So these are specific suicide and self-harm prevention. That's research on the training that we provide across the region, developing policy and practice guidelines for working with young people in relation to self-harm and suicide attempts, safety planning specific research project, which is taking off really well. We've got some really good progress and there's lots of service user involvement with that one, and a study of the use of safety plans to reduce self-harm and suicide for autistic adults as well. Thank you. Next slide. Thank you. So we continue to drive our training modules right across the region as far as we can. Our training that we bought into has different modules based on who the particular audience will be, but one of our main drives at the moment for this is getting this training to schools and to young people. And so Suzanne, who's also on the call, might be able to give a quick update at the end if we have questions specifically to that. But this project's really promising because we're going to be going into schools, providing some of this training to our young people, and also developing our relationships and engagements with schools on the project and the training that we deliver. Next slide, thank you. So we continue to focus reaching those who don't reach our services, and we know that that's a big gap and it's a big area that we need to focus on. We have drives on our social media pages within our suicide prevention network for the ICS, and we continue to have posts and engagement with our communities through this, which also includes self-harm. Collaboration is a really key focus that we've got, particularly at the moment with our primary care network. So I think it's been touched on before earlier, but I think one of the issues is often capacity within primary care and getting engagement. So we've currently got plans to have some workshops to develop our relationships with primary care, and to also they've actually currently just agreed to take on some of our training, which is really promising, and we hope that will help them to manage self-harm and mental health in general when they're coming across it, to strengthen the support they get from us as not just the ICS but services altogether, but more importantly the care that the patient and the service user receives from them, particularly relating to self-harm and suicide prevention. Within the Northeast particularly, there's some really good grassroots projects and charity organisations focused on more creative digital. I think you've mentioned it before, the creative digital element of intervention and how we can reach people in a different way. So there's quite a lot of projects in the Northeast that are focused on that specifically. We did notice that there's a gap. There's definitely a gap in terms of specific self-harm projects and organisations, which we hope over time will develop. There's lots and lots on suicide prevention, but definitely a gap in self-harm. Next slide, please. Thank you. This is just a brief example of a creative tool really that's used specifically in Cumbria. So these are self-harm kits that are distributed to services, primary care, schools, anybody that requests them, where there's guidance on self-harm. There's some, like I think you can see there, there's advice on how to keep self-harm wounds clean and using other alternative techniques that might be helpful. It's been a really, really well welcomed project in Cumbria. Next slide, please. And these are our resource tins. I know we've talked about these quite a lot over the past year, so some of you might already be familiar with them, but these are aimed at suicide and self-harm. So these resource tins we have distributed right across the region. We have them in lots and lots of different organisations and services, particularly GPs again, pharmacies, schools. Anyone that requests them can have them, and within that tin is self-help tools, resources, information on how to access support. And the idea, really the fundamental idea behind this, is that people that don't feel confident enough to be able to come out and say, I'm struggling, I need some help, can just pick something out of the tin that they would need for resource and support. Next slide, please. And right, so further plans to what we're currently developing, all the stuff that I've already talked about and the current work. Within this year, we want to have a campaign specifically focused on self-harm. So that's within our suicide prevention network, and we'll reach the whole of the region. And also to develop some self-harm community workshops where we just try and improve engagement from various different sector organisations, service users themselves, and anyone that we can get involved really. Some future needs and areas that we really think we probably need more focus or support on is more creative ideas on reaching communities, so particularly those that don't access services. I still feel like, as some of you have mentioned earlier, it's still a really, really significant gap, and we'd like to learn from each other. Again, like it's already been mentioned, so what are other areas, what are other regions doing? Is there any specific projects that are out there that we could learn from? And a bigger drive on self-harm separate to suicide. So I think I actually hadn't thought about this before, and it might have already been mentioned in some of the national workshops, but was a manager who had experience as a service user herself, and she said that it can be a barrier to accessing services when services might be specifically targeting self-harm and suicide together. And she recognised that although there's a definite link, and that there's an absolute crucial element for services to focus on self-harm and suicide together, like we've talked about, the risk indicators and the data we know, but there definitely seems to be a need for specific self-harm, like this project we're talking about today, but more and more, if we can, to keep self-harm not separate, maybe that's the wrong word, but to have specific self-harm interventions more increasing. That's me. I've given a really quick snapshot because I'm conscious we were over time and there might be questions for you at the end.